Motion Presentation by Holly Hendricks. The objective of this presentation will be to go over observations from 8 John Summers Flanagan videos, application of psychological theories and how they apply to various clients, biblical worldview integration, as well as learning application. Claire, opening wishes and statements. As the session begins, Dr. John explains their confidentiality policy in a way that is easy for a 12-year-old to understand, as well as communications with their parents and what that would look like and when that would occur. Claire's wishes are for a little sister, more time for school, and more quality time with her parents. Dr. John demonstrates active listening skills by his body language and affirms Claire's responses by nodding, paraphrasing what she said back to her. The 3-step emotional change trick. A continuation of the last session, Dr. John explains the 3-step emotional change trick in a way that Claire can easily understand. As they are going through the steps, Claire provides feedback about her emotions and coping skills she is already using. Dr. John takes time to emphasize that her emotions are her emotions and they should be honored, but when she wants to feel differently, she can do something different and think a new thought. Dr. John introduces a surprise 4th step, teaching the steps to someone else, and Claire loved that. Claire, what's good about you? Dr. John explains the activity to Claire before they begin. He asks Claire 10 times what's good about you. Claire is very responsive and seems to enjoy this activity. Dr. John summarizes his observations from her answers and points out recurring themes. Dr. John notices Claire's efforts to be good to others and her desire to make others happy, which seems to encourage her. He creates his own What's Good About Claire list, which is based off of her original list and what he's learned about her. Claire, closing and summary. Dr. John brings the session to a close by coming back to the wishes and goals that were established at the beginning of the session. He communicates his thoughts about what she said in a way that validates her feeling but emphasizes that she can be impressed with herself and not need to strive to impress others. He suggests for her to look into her life to see if she already has others who are looking up to her, and she thought of one immediately. He suggests her asking her parents in a kind way to spend more quality time with her. Dr. John concludes the session by asking if there's anything from the session she would like to remember. Claire states that thinking about her behaviors and goals in a safe environment was beneficial for her. The psychosocial development theory. There are 8 stages of development an individual goes through in their life, spanning from birth to death. Ages 5 to 12 is the stage of industry versus inferiority. Children in this stage become able to complete more complex tasks and attempt to acquire new abilities. Encouragement from support figures will help provide a sense of proficiency and self-belief. Erickson believed that identity formation is the most important developmental task when transitioning from childhood to adolescence. Presence of adequate support structures as well as physical support and guidance create emotionally and socially healthy individuals who are equipped to handle various struggles throughout their lives. In relation to Claire. Claire is 12 years old and she's becoming more confident in the tasks she enjoys, such as drawing and crafting cards. She is also seeking to gain new skills, such as running track, even though she didn't enjoy it. Claire's indication of a desire to spend more time with friends and grow in her social skills shows that she is attempting to form her own identity. Claire's level of emotional and social intelligence and health indicates that she has had a great support system, but her desires to spend more time with her parents, have someone look up to her, and impress her peers indicates that she might need additional support and guidance during this time. TJ and anger management. Dr. John starts the session with opening goals and wishes. TJ seems to be uncomfortable and rigid. Dr. John asks permission to ask TJ some exploratory questions about some of his anger management issues he's had. Dr. John notices physical strength is important to TJ and asks, aside from strength, what other attributes would make TJ valuable. TJ indicates a desire for social skills, which would include him being tolerant and helpful. Dr. John asks, in 2 years, what would it look like if you were a tolerant and helpful person? TJ says he would be a motivational speaker, going to jails and other places, telling his story of redemption, and his first step was asking for help. TJ seems to be currently involved in a supportive drug and alcohol rehabilitation community. Maslow's hierarchy of needs. Individual needs must be first met at a physical level and then a psychological level. The basic physical needs consist of eating, drinking, sleeping, safety, shelter, and a sense of being loved or feeling belonged. The psychological needs are esteem and self-actualization. Esteem consists of feeling worthy of respect or being respected by others. This could include a drive for power, success, competence, or freedom. Self-actualization is the final level and is essentially being what one wants to be. In relation to TJ, the fact that TJ is in a recovery community indicates that his immediate physical needs have been satisfied, as recovery communities generally meet needs for safety, shelter, clothing, food, and they also provide a sense of community, which would fill the need for love and belongingness. His desire and drive to be a motivational speaker encompasses the need for esteem and self-actualization. It is because his primary physical needs have been met that he can examine and strive for his esteem and self-actualization needs to be met. Lewis and motivational interviewing. Dr. John begins by asking Lewis questions about his drinking, starting with what he likes about it, then what he dislikes about it, and how he's been able to cut back before in his current drinking habits. Lewis indicates that he is regularly drinking several nights a week and binging on one night. Lewis believes he is in control of his usage and the amount he is using is okay for him. Throughout the session, Dr. John paraphrases what Lewis is saying back to him with some motivational alterations which emphasize the negative consequences of drinking. Lewis has been through an alcohol addiction treatment program. Dr. John uses the CAGE method to assess for an alcohol abuse issue, which indicate that Lewis might have an alcohol issue. Cognitive dissonance theory. Cognitive dissonance is essentially an internal sense of disequilibrium and discomfort that comes from one's thoughts and values not being aligned with their actions. Cognitive dissonance is uncomfortable and will motivate one to reduce this level of dissonance by either altering their behavior or altering their beliefs. If the behavioral element is a source of satisfaction to the individual and altering this behavior will cause one to feel pain or loss, then there will be resistance to this change. In relation to Lewis, it seems due to Lewis's previous experience with alcohol and attending an alcohol program that he is aware of the negative consequences of drinking. But by drinking, his actions are not allowing with his beliefs, and it seems that to reduce this cognitive dissonance, he's rationalizing his drinking and his control over it. The behavioral element, drinking, certainly is a source of satisfaction for Lewis, and stopping this behavior would be difficult and painful for him, which would cause him to be resistant to changing this behavior. Sample CBT session on social anxiety. Dr. John begins the session by creating an agenda, which is like opening goals and wishes. Meredith states she's having social anxiety in her classes at school, which caused her to feel anxious and awkward. Dr. John asks for a specific example of when she felt that way and what her thoughts were in and after the moment. Dr. John explains that her thoughts can influence her emotions and our feelings. He helps her identify helpful thoughts and unhelpful thoughts. Dr. John helps her see that her thoughts in stressful moments can take her into a negative spiral, and to better prepare for those moments, she could think helpful thoughts ahead of time. Social identity theory. Individuals derive a part of their self-concept from their reaction to their social group. This is conceptualized by focus on oneself as defined by the group or in relation to fellow group members. Intergroup relationships can include utilizing group norms to assess the similarities and differences of others in relations to oneself. This can result in the inclusion of those with more deemed similarities and exclusions of those without. In relation to Meredith, Meredith is examining her own actions against the actions of others within the group. Because Meredith feels that her answers are not similar to the others within the group, she is feeling feelings of exclusion and anxiety. Meredith's experience within the group seems to shape how she views herself and her identity in relation to the group as well as apart from the group. Mental status examination. Dr. John opens with explaining that he will be asking some routine questions. Carl is responsive to the question and occasionally rambles a bit, but Dr. John nonchalantly redirects the conversation back to the questions. When giving an in-depth explanation of his name, it seems that Carl might have had a difficult upbringing. Dr. John examines multiple cognitive capacities of Carl, and when there's a concern, he asks more exploratory questions without indicating that there is a concern. Carl seems a bit fidgety, but maintains good eye contact throughout the session. He could have a mild tic, or he could have a cold. Social cognitive theory. This theory illustrates the relationship between thoughts, behaviors, and environments in which learning occurs. Learning occurs when an individual watches one model attempt a behavior and is motivated to attempt to perform the behavior themselves. Perceived similarities between the individual and the model, as well as model competency or status, would increase the likelihood that an individual would attempt to perform the same model behaviors. In relation to Carl, while there isn't any obvious learning occurring in this setting, Carl seems to have some very specific beliefs and opinions. I hypothesize that some of these beliefs and opinions were learned from someone whom Carl felt similar to or looked up to. In this case, the model would have been someone Carl perceived to be competent and would have voiced these opinions, and Carl felt motivated to adopt these opinions as his own. The biblical worldview integration. Philippians 2:3, do nothing from selfish ambition or conceit, but in humility count others more significant than yourselves. While the Bible is not mentioned directly in any of these counseling sessions, it is clear that Dr. John holds himself to biblical standards as he speaks to everyone in the same manner and treats everyone with so much love and respect throughout the sessions. Learning application. I've learned the importance of rapport and how Dr. John establishes it. He speaks in a level tone, always. He is very soft, but yet authoritative, and he actively listens and engages, and he speaks to each person how they need to be spoken to. He communicates in a way that the clients will understand and not feel inferior. He doesn't use textbook definitions and big terminology that no one could comprehend. He speaks to each client in a way that they can perceive and understand. He is also prepared to politely redirect back to the topic so there's no rambling. That makes best use of the short periods of time that you have in counseling sessions. He also has taught me to clearly communicate goals and methods early and often. So you explain what you're doing before you do it, while you're doing it, and you give the client the ability to ask questions. He also encourages the client to respond by actively listening and validating their responses. Thank you so much. Here are my references.